Hello, my name is Mariam Nahab, a student nurse from Harper College, and I'm going to do a head-to-toe assessment on one of my patients. Her name is Rahma. Okay, so looking at the fact that we could be in a hospital setting, uh, I have to do my hand hygiene first, and then I knock onto her door and introduce myself. And if I'm maybe in a home setting, still I have to knock onto her door, introduce myself, do hand hygiene before doing anything. Okay, after doing my hand hygiene, I knock onto her door. Ta 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 ta. Hello, good evening.
Good evening.
My name is Mariam Nahab. I'm a student nurse from Harper College, and I'm here to do a head-to-toe assessment onto you. How are you today?
Good, how are you?
I'm fine. Could you please tell me your name and your date of birth?
My name is Rahma Kosinje. My date of birth, May 13th, 1978.
Okay, do you have any allergies?
No allergies.
Okay, as she gives me that information, I have to confirm with her armband to make sure I have the right information. She's giving me the right information. Then after that, I have to check out for her airway, the breathing and circulation. Her airway seems normal because she has been talking to me. And her breathing, I look at for the rise and fall, and it looks normal. Then circulation, I'll have to touch her skin, both hands, to make sure that circulation exits according to what I'm doing here. I'm checking out for her circulation. I'm touching her both hands, and the circulation is okay. Then I also have to confirm circulation with radio pulses. So radio pulses are regular and strong. Then I have to assess her level of consciousness, and according to what I see here, Rahma is fully conscious. And after that, I will have to assess her orientation. Rahma, could you please tell me where you are?
I'm in Palatine.
Could you tell me the time and the day of the week?
It's 7 p.m.
Okay, and the day?
And Wednesday.
Okay, she's just giving me the right information, implying that she's fully oriented. And then after that, I will have to proceed and check out her vital signs, which include the blood pressure, the temperature, the oxygen rate, and the pulses themselves. Okay, right now I don't have the equipment to measure her oxygen levels. I don't have equipment for blood pressure, but I can measure her epical pulse because I have I can check her epical pulse. I can also check her radial pulse. So I'm gonna check at least the radial pulse and compare it with the epical pulse for now. Okay. So right now I'm measuring her radial pulse for 1 full minute. Okay, according to her radial pulse, it's around 64 beats per minute, which is normal. Okay, after her vital signs, I'll now have to move on to her pain assessment. Rahma, do you have any pain?
No pain.
Okay, Rahma says she does not feel any pain. Then if Rahma has any tubings, drains, I'll have to look onto those and make sure they're all running fine. Look out for anything that is wrong and clear it. And then after that, I will be doing now from head to toe. I will have now to assess her head and eyes and mouth first. Rahma, could you please help me move your head to the left and then to the right? Okay, could you please move your eyes following my finger? Okay, again to the left. Good. Then I open her eyes to look at the scalary. The scalary is all white in both eyes. And now, after the eyes, open your mouth. Ah, good job. I'll have to use my pen light to assess the mouth. The tongue is almost, the mouth is moist too, and the teeth are white. Okay. After the head and this, I'll have to go on to her chest, and the chest, her chest. So I'm going to assess her chest. I'm going to look out for lung sounds, which is very, very important, and also for the respiration rate, for the rise and fall. And okay, Rahma, do you have any shortness of breath?
No.
Okay, do you have any problems with breathing?
No, I'm fine.
Okay, she says she doesn't have any shortness of breath. So I'm going to assess her lung sounds. Could you breathe in for me? Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Good job. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Good job. Okay. According to what I see with Rehma, her lung sounds are all normal. Yes. So I'm gonna assess her apical pulse for 1 full minute. Remember, I took the radial pulse, so I'll have to compare with that. Okay, her apical pulse is about 64 beats per minute, which is rhyming with her radial pulse. So Rehma's circulation, breathing, airway, they all seem to be normal. And after assessing her chest, now I'll have to move on to her abdomen, and I'm gonna Rehma, could you please help me lean forward behind? Thank you. So I'll have to open it and look at it. It's all round and in good shape. The skin is intact, and the skin is it's okay for the ethnicity. Then after inspecting it, I'll have to again look for bowel sounds, and I also have to ask her if she has had a bowel movement. Rahma, when did you last have a bowel movement?
In the morning.
Wow, that's good. She said she had a bowel movement, her last bowel movement in the morning. So I'll have to go on and look out for the bowel sounds. I'm gonna feel your bowel sounds, okay?
Okay.
Do you have any pain anywhere?
No.
Thank you. Okay. Okay, the bowel sounds all exist, and then I'll have to feel the tenderness. I'll have to feel it now, palpate it with my hands to see if it's a tender and soft or firm. in all the 4 quadrants, the abdomen, and it all seems to be soft and tender. She doesn't have any complications with her abdomen. So after that, I'll have to move on to, after the abdomen, I'll have to move on to her upper extremities, and those are her hands, where I'll have to assess the temperature, the sensation, and the strength of her arms, and the pulses too of the upper extremities. Okay, I'm going to do an assessment on your hands. So I'm here assessing her circulation. It's all warm and the skin is intact. Then radial pulses. Radial pulses they're all strong and regular. Remember, I earlier took a complete 1 minute radial pulse, which came out to be 64 beats per minute. And in both hands, as I touch them, they are strong and regular. And after assessing her circulation, then I have to look out for her sensation. What hand am I touching?
Right.
Okay, what hand am I touching?
Left.
Okay, so after feeling her sensation, I would have to look out for her strength. Rema, could you pull my hands? Could you push? Could you hold firmly my fingers? Okay, she has done all this with a lot of strength, implying her upper extremities are fine. Both of them are being assessed at the same time. Okay, then after that, I'll have to move on to her lower extremities. And Rem, I'm going to assess your lower extremities, and I'll be putting off your socks for now, okay? Okay, so I move on to her legs, and I assess her right from the thighs, coming down, looking out for the temperature, for the sensation, for the color, and for the strength, and look out also for the pedal pulses, and look out for any edema on her feet. Okay, so her temperature is okay, the skin color, skin integrity is fine and okay for the ethnicity. So I don't see any signs of edema. Rehma, what foot am I touching?
Right.
Okay, and what foot?
Left.
Okay, thank you. And could you please move your feet out for me? Okay, bring them back, push them back again and up. She can do all these successfully, implying that the strength exists, her strength is strong. Then I have to look out for pedal pulses, feel for both of them. Okay. Okay, both pulses are strong and regular on both feet. Sorry, we are unable to look at the feet. I couldn't push them up a little. Pull them up a little bit. Yes, like that. I think you can see them. I'm feeling the pedal pulses with both fingers of mine on both feet, and her circulation. I'll move your feet again outwards and inwards. Okay, applying her feet are strong, and the color is fine. The ethnicity. Then I look out for her heels. Her heels are all okay and intact. Skin integrity is okay. Correctma. Then I'll have to look out for capillary refills on both feet, all the toes. All capillary refills are fine. They're less than 3 seconds, implying her circulation is good. Capillary refills on the fingers too. Sorry, did not do this the other time. Capillary refills on the fingers too are all okay. No signs of edema. Capillary refills are fine. Circulation is fine. Pedal pulses are strong and regular. So lastly, I'll have to look out for her skin integrity at the back. I've looked at her heels already, so I'm going to look at her back and buttocks to make sure she doesn't have any bed sores or any openings or bruises, just to make sure. Just look at her skin integrity and see how it, in other words, I have to look at the skin integrity and see how her skin is. Yes. Okay, Rahma, sorry, I'm gonna uncover you. Her skin, according to what I see, is all okay. It's intact. She doesn't have any bed sores. Her buttocks, everything seems fine. No trouble, no bed sores, no bruises. Yes. And after doing the skin integrity, I think I have to make sure I assist the patient in a comfortable position. And then after putting her in a comfortable position, I have to give her call light to make sure she calls for assistance when she needs it. Then I have to, in case she has like a hospital setting, I extend her table and give her everything that she needs, her water, put them on the table, phone, water, anything that she needs that she normally uses, I put them on the table and tell her to call for any assistance. And I have to inspect the environment to make sure it's safe for her to be in before I leave the room. Then I thank her. I thank you, Rehma. Yeah, please call for assistance when you need it after giving her the call light. And that marks the end of my head to toe assessment with Rahma. Thank you. Bye-bye.